Glad you tuned in today. We're going to talk a little bit about vaccines in dogs. I'm going to tell you a little problem we have as veterinarians is that a lot of times clients come to us with instructions from the breeder as to what we should use for vaccine. Not so much the brand, but what kind of vaccines, what's in it. Typically what we always dealt with was DHPP, and this is distemper, hepatitis, parainfluenza, which is an upper respiratory thing, and then the big one over here is parvo. Now, sometimes the folks show up with a new puppy and their instructions from the breeder are, they don't want the L in DHLPP. L stands for lepto, and I'll write it down here. There's a really long name for it. It's a spirochete, but it's Leptospirosis. And there's a number of varieties of these, or another, there's Leptospirosis canicola, there's Leptospirosis ictro-hemorrhagica, there's Gripotyphosis, and there's Pomona. So they're all separate. They're all distinct entities of themselves. They just belong to the same family. So you kind of want to look at it like a family of 4 kids. These are the 4 kids, the 4 genuses of this particular lepto is a problem, with dogs in general. And the thing we have the biggest problem with here is, I'm going to tell you right now, is the fact that this does not affect people, 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 this, if it's replicated in your dog and shed, can cause problems with your family. So that, as far as I'm concerned, is a really important thing. When breeders tell this to clients, what they're really worried about is that their dog's going to have a reaction to this lepto when they administer the vaccine, where the face swells up, maybe you get a lump where you gave it, lethargy. I guess we're all probably familiar with the COVID vaccine. Some people didn't have any problems with it. Some people had problems with it. And I'm afraid that lepto is one of those things. However, if your dog does not get vaccinated for lepto and gets lepto, there's a fair number of those dogs that just plain go away. And this can happen at 10, 12 weeks of age, could happen at a year of age, could happen at 2 or 3 or 4 years of age. So we think that it's very important that you give this to your dog, irregardless of what the breeders tell you. The breeders are worried about the reactions. Well, the problem is that what some veterinarians have done. They'll call the breeders and say, okay, we want you to assume whatever risk is involved with this dog getting these and the medical cost of treating this dog for leptospirosis if it gets it. Well, breeders are never going to sign that. They're just going to tell people what to do, but they're not going to take any responsibility for it. Now, not all breeders are like this, just some, a few. And some of them have had problems with the vaccine with reactivity. And when they do have problems with the reactivity, they don't want their line of dogs blamed for this because maybe the veterinarian said, well, some dogs react to this. And quite frankly, here's the dogs who react to lepto. Any little white dog, which would be like a Westie, those sorts of dogs. Any dog less than 10 pounds, any dog that has his face pushed in that weighs less than 25 pounds, that would be Bostons, French Bulldogs, those kind of dogs, and every dachshund. So we at our place, when we use this vaccine, we use it on everybody, we go ahead and make sure that those dogs, the little white dogs, the Malteses, the Westies, the dachshunds, any dog weighs less than 10 pounds, and any dog with his face pushed in, brachycephalic dogs. So we make sure they all get Benadryl, and we give them an injection of Benadryl at the time we give the DHLPP. We don't think that you could have a reaction to any of these vaccines. This is probably the one that's most likely to cause a problem. But if your dog gets lepto and then shed it in the urine, and then somebody's playing around with the dog or puts their hand someplace where the dog wet, and then inadvertently touch their hands to their face, somebody drops a cookie on the ground, whatever. It's easily transferred from dogs to people. I'll tell you a little story. I was at a meeting one time in Kansas City, remember it very vividly, and there was a guy from Wisconsin gave a lecture on leptospirosis, and it was very good. They talked about a German Shepherd who'd gotten had lepto, diagnosed for lepto, but they hadn't gotten the results back. And the dog had gotten loose after they gave him 1 dose of flucilin, which is a long-lasting penicillin. And that dog ran around Madison, Wisconsin all winter, and they thought, well, this dog has got to be dead because it had lepto and it was sick when it happened. And they found that dog 3 or 4 months later, fine. It was still running the streets. They got it back to the owner and everything, and it didn't have lepto anymore because fortunately they had vaccinated this dog prior to this happening. So the fact and point being here is that I got on the bus to go back to the airport because it was the last lecture of the day, and I sat next to a guy, and we got to talking. Veterinarians are usually like to talk to each other and everything, and this guy's a veterinarian. He says, I said, what do you do for a living? The guy says, I write the I edit the infectious disease book for veterinarians. I said, oh, wow. And I said, well, you would really like this lecture that I went to. It was about leptospirosis. And he says, I don't think I would have enjoyed the book, that lecture at all. And I said, why is that? It was very enlightening. He says, when I was in vet school, I got lepto in vet school, and I went in the hospital, and they treated me with not the correct antibiotic, and I ended up losing one of my kidneys over the whole thing. In fact, both of my kidneys, and he had to have a kidney transplant. So that's the sort of stuff we're talking about. I'm not trying to sensationalize this or anything, but it's a zoonotic disease. In other words, one that'll affect people and then other species. So we have to be very careful of this. And we have to be very careful that we explain this to clients. And clients know about this going forward. And this is not a scare tactic by me today, but you just need to know that if you give this vaccine, this is a safety factor for your family when you do this. Dogs get this. In fact, they get it from like drinking out of mud puddles. I got lots of stories. I have a story about a bunch of triathletes that were up in Minnesota that 60 of them went in the water, on the swimming part of their triathlon, and I think like 46 or 43, something like that, ended up with leptospirosis and had to be attended to. So it's an important thing. If breeders tell you that you don't think your dog should have lepto, you take your advice on whatever you want from the breeder, but the veterinary end of it should be the veterinary end of it, and you should be taking the advice of your veterinarian. I think that's very important. And there's 4 serovars of this: Gripo typhosa, Ictrohemorrhagica, Pomona, and Canicola. And it is the most reactive part of the vaccine we have, but we think it's probably one of the most important parts of the vaccine. And that disease exists, and it's fairly common. And I'm just here to tell you that nobody knows everything. Even the veterinarian doesn't know everything. But quite frankly, we will make recommendations based on what we think is in your dog's best interest, and really, in this case, in your best interest, in your family's best interest. So, leptospirosis, it's a little reactive, but it's a lifesaver, maybe for everybody. That's all I got to say about leptospirosis.